In penicillin, there are different types of penicillin. First is penicillin G or benzyl penicillin, primarily given as a parenteral route. Parenteral means what are the different routes of parenteral route? IV, primarily for penicillin IV and IM. IV and IM. Then procaine penicillin is the most allergic penicillin. Then benzythine penicillin, it is the longest penicillin. Longest penicillin is benzythine penicillin. Another one is crystalline penicillin. So, benzyl penicillin, crystalline penicillin, procaine penicillin, which is the most allergic in nature, and longest is benzathine penicillin, not benzyl penicillin. Benzathine penicillin is the longest acting. Then came the penicillin V. Penicillin V or phenoxymethyl penicillin. Phenoxymethyl penicillin or penicillin V. What is the importance of that? It can be given orally. So all other parenteral route which is given either in IV or IM is acid labile, cannot be given in a oral route. So oral route penicillin is penicillin V or phenoxymethyl penicillin, can be given orally. Then aminopenicillin, ampicillin, amoxicillin, primarily ampicillin, amoxicillin. Then came extended spectrum penicillin, where they can inhibit pseudomonas. Pseudomonas is a gram positive or gram negative bacilli. Other than pseudomonas, what are the different types of gram negative bacilli? Shigella, Salmonella, E. coli. They can be controlled by other antibiotics, but pseudomonas is difficult to control. So anti-pseudomonal penicillin, for MCQ purpose, anti-pseudomonal penicillin is Carbenicillin, Piperacillin, Ticarcillin and Methicillin. These are the penicillin. These are also extended spectrum penicillin, but their characteristic is they can inhibit pseudomonas, whereas ampicillin, amoxicillin, they are extended spectrum. They can, distribution is better, they can given orally. So which penicillin can be given orally? Penicillin V. And which extended spectrum penicillin can be given? That is ampicillin, amoxicillin, which is aminopenicillin. Clear? So pharmacodynamic advantages with the anti-pseudomonal extended spectrum. Pharmacokinetic advantage is with the aminopenicillin, ampicillin and amoxicillin. Beta-lactamase, what is the disadvantage of beta-lactamase? They break the beta-lactam ring. So they have the antibacterial activity will be less. So there are some antibiotics or penicillins which are beta-lactamase resistant penicillin or anti-staphylococcal penicillin with among them Methicillin, Cloxacillin, dicloxacillin, ocloxacillin and Nafcillin. These are the beta-lactam resistant penicillins. Clear? So first penicillin, primarily given penicillin G. Procaine penicillin is the allergic one. Longest penicillin acting. Very good. These are all given parenterally. Oral is penicillin V. Then among extended spectrum, there are two types of aminopenicillin. Aminopenicillin, ampicillin, amoxicillin can be given orally, and their spectrum is also increased towards the gram negative one. Similarly, more extended spectrum penicillin is anti-pseudomonal penicillin is there is Carbenicillin, Ticarcillin, Piperacillin. These are extended spectrum anti-pseudomonal penicillin. Then beta-lactamase resistant penicillin. Beta-lactam resistant penicillin is Cloxacillin, Methicillin, Dicloxacillin, or Cloxacillin. Clear? এই পর্যন্ত শিখেছি অ্যান্টি-সিউডোমোনাল পেনিসিলিন কোনগুলো এক্সটেন্ডেড স্পেকট্রাম, কোনটা which penicillin can be given orally, which extended spectrum penicillin or penicillin derivatives can be given orally, ampicillin, amoxicillin. Then beta-lactamase resistant penicillin. Okay. Penicillin G, acid labile, narrow spectrum. Acid labile and narrow spectrum. Procaine, sodium penicillin G and benzoyl. Then came semi-synthetic penicillin. For semi-synthetic penicillin as a short note. Semi-synthetic acid resistant alternative to the penicillin G is penicillin V. It is a semi-synthetic. Why semi-synthetic? By changing the side chain. By changing the side chain only, this semi-synthetic penicillin, then penicillin is resistant penicillin, ki? Methicillin, Cloxacillin, Cloxacillin and Nafcillin. Then extended spectrum penicillin, among them Ampicillin, Amoxicillin, Aminopenicillin, Carboxypenicillin and Uridopenicillin. And among these Carboxypenicillin, Ticarcillin, Carbenicillin, Piperacillin and Methicillin is the urido. So what is the advantage of that? Piperacillin, Ticarcillin, extended spectrum, anti-pseudomonal activity. Extended spectrum with acid resistance is extended spectrum penicillin which has a can be given orally, Amoxicillin, Ampicillin. Then semi-synthetic, so all these acid resistant, penicillin is resistant, extended spectrum, all came under the semi-synthetic. Semi-synthetic. Why semi-synthetic? By altering the side chain, we develop this special character to the penicillin. So what is the disadvantage of penicillin then? Penicillin proper, what are the disadvantage? First is that it can be given orally. You prefer an injectable drug or an oral drug? Oral drug, because it requires less skill. So first thing is that. Second thing, there is this narrow spectrum. Spectrum is narrow, restricted to which type of bacteria? Gram positive. So to take care of these two advantages, orally and extended spectrum, spectrum is increased by ampicillin, amoxicillin. Ampicillin and amoxicillin also can be given orally. Similarly, carbonicillin and piperacillin, they are extended up to pseudomonas. Gram positive less, gram negative and gram negative like pseudomonas, which is a difficult bacteria. That is also covered by the carbonicillin and piperacillin. These are carboxypenicillin. And there is another term is, what are the different beta-lactam? So you have to remember two things. Carbapenems are different and carboxypenicillin are different. It is a penicillin extended spectrum. Carbapenem is, though it is a beta-lactam group of drug, it is a different drug. Imipenem, Meropenem, these are also beta-lactam drugs, but they are different from the carboxypenicillin. Carboxypenicillin is extended spectrum penicillin like Carbenicillin, Ticarcillin. Clear? এই পর্যন্ত না আবার বলবো। ফার্স্ট হচ্ছে পেনিসিলিন জি। ডিফিকাল্টি কি এতে? ইনজেক্টেবল দিতে হয় ন্যারো স্পেকট্রাম, ওরালি অ্যাসিড লেবাইল। তাহলে এই দুটো টু ট্যাকেল দিস টু উই গো ফর সেমি সিনথেটিক পেনিসিলিন, purely acid resistant penicillin. Spectrum is not increased but can be given orally. Name is penicillin V. Clear? Penicillin V spectrum is not increased but it is acid resistant, can be given orally. Next one is penicillinase resistant. Penicillinase is an enzyme that breaks down the beta-lactam ring. Clear? There are some drugs like Methicillin, Cloxacillin, Cloxacillin can be given in a penicillinase producing organism. Among these, Cloxacillin is acid resistant and oral also. Not all. Cloxacillin can be given orally, that is also even against the beta-lactamase. Clear? Methicillin acid labile but injectable, rarely used nowadays due to nephrotoxicity. Cloxacillin, dicloxacillin, all these are penicillinase resistance, but these drugs are reserved for penicillinase producing organism. It should not be given organism which is sensitive to penicillin, because it can induce penicillinase or beta-lactamase. Clear? So only when there is a penicillinase producing organism, then only we go for this drug, penicillinase resistant. Then extended spectrum. Extended spectrum means they cover more towards the gram negative. Gram positive যেমন আছে, if lesser plus gram negative. Among these there are two, Ampicillin, Amoxicillin can be given orally also. And there is other one is Ticarcillin, Piperacillin, Carbenicillin. These are given injectably, covered gram negative along with Pseudomonas. Clear? So penicillin G, benzoyl-penicillin, less penetration in the CSF, rapid renal excretion, narrow spectrum. Then already discussed sodium penicillin G, broken penicillin is the most allergic one. Benzathine penicillin is most and ki susceptible to penicillinase. Acid stable is Ampicillin, Amoxicillin and their products. Acid labile but anti-pseudomonal penicillin is Carbenicillin, Piperacillin, Ticarcillin and Methicillin. Already discussed these things. Methicillin. Nowadays we rarely use Methicillin. Due to its toxicity. Which type of toxicity? It is nephrotoxic. Is it acid labile? And if we give any Methicillin where there is no penicillinase producing organism, they can induce penicillinase. So penicillin susceptible organism we can't give it. We cannot give it even it is producing penicillinase because of its nephrotoxicity. So how we can say the drug is methicillin resistant? Because we cannot use clinically methicillin. Now if a is resistance against cloxacillin or Nafcillin, then we can say it is resistant to methicillin also. Clear? Methicillin clinically not used due to its nephrotoxicity. Even it is susceptible penicillinase producing organism. So how we can say that? If an organism is resistant to Cloxacillin or Nafcillin, we can say that it is resistant to Methicillin, and it is MRSA, Methicillin resistant Staphylococcus aureus. What is the mechanism of this resistance? You have a resistance to producer? Very good. By altering the penicillin binding protein, not like penicillinase, production of penicillinase or beta-lactamase. Penicillinase or beta-lactamase, these are enzymes produced by organism. They break down the beta-lactam ring. Clear? But here the alteration is in the target. The target is penicillin binding protein. This penicillin binding protein, they alter their affinity towards any of these beta-lactam antibiotics. So if there is a lesser affection, they are unable to bind with the penicillin binding protein, so less effective. So MRSA develop when there is a resistance against Cloxacillin or Nafcillin. Amino acid, amino side chain, Aminopenicillin, they have two advantages. One is they cover gram negative, and they has a oral resistance also, but they are not effective against penicillinase enzyme. They can break down. So among these Ampicillin and Amoxicillin, they produce a common side effect is diarrhea. Why? Because there is an incomplete absorption in the upper GIT. So these antimicrobial agents go into the lower GIT. And what happened then? They kill the common cells, good bacteria in the colon. So pathogenic bacteria taken overhanded, and they can produce diarrhea. Among these Ampicillin and Amoxicillin, Ampicillin, as their pharmacokinetic characteristic is that they are less completely absorbed, they are producing more diarrhea than the Amoxicillin. So why we prefer Amoxicillin over Ampicillin? Because Amoxicillin more completely absorbed in the upper GIT, so lesser amount of Amoxicillin goes into the lower GIT, and less amount of diarrhea, less incidence of diarrhea compared to the Ampicillin. Clear why we prefer Amoxicillin over Ampicillin. Now anti-pseudomonal penicillin is, one is carboxypenicillin, carbenicillin. They are anti-pseudomonal effects. Neither penicillin is not acid resistant. Then in which would it has to be given? Acid resistance na hole injectable. Injectable dite hobe. Interfere with the platelet, may cause, as all these drugs having a sodium salt, they can produce or exaggerated heart failure by water retention. Sodium jodi beshi thake shorire, water retention. Among these, Piperacillin is based anti-pseudomonal penicillin having a zero order kinetic. So among these carboxypenicillin, Ticarcillin, Piperacillin, Methicillin, Piperacillin has the best anti-pseudomonal. Methicillin has among all these, only Methicillin has a hepatic metabolism. All other commonly given excreted to the kidney primarily. Inactivate with the aminoglycoside. Like penicillin and aminoglycoside is synergistic or ineffective. Synergistic when given in two different injections. But if we mixed it in a same syringe, this is a pharmaceutical type of drug interaction. It is advantageous when given in two different vial or syringe through. But if we mix it in a same syringe, they reduce their efficacy. There is another group of drug, Imipenicillin. They are reverse spectrum. Reverse spectrum means now up to this penicillin is a covering is gram positive. Then extended spectrum gram positive plus gram negative pseudomonas. It is reverse one. That means they cover primarily gram negative. Methicillin and Piperacillin is the characteristic drug in this group. They cover, though they have a beta-lactam ring, they are covering more gram negative. So it is called reverse spectrum penicillin. So up to this penicillin means penicillin G, penicillin V, extended spectrum penicillin, which cover why we preferred Amoxicillin over Ampicillin. Which one is anti-pseudomonal penicillin. And different, you have to remember two difference, there is a difference between Carbapenem and penicillin. Both these are started with the C. Both are beta-lactam ring is there, beta-lactam antibiotic, but they are different. Now beta-lactamase inhibitor, these drugs, they have no antimicrobial property, but they have a beta-lactam ring. So when we give these drugs along with beta-lactam antibiotic in a beta-lactamase producing organism, this beta-lactamase is going to destroy beta-lactam ring. So these beta-lactamase inhibitor also have the beta-lactam ring. These beta-lactam rings are preferred, and there is breakdown of beta-lactam ring of beta-lactamase inhibitors. So what happened? The beta-lactam ring of beta-lactam antibiotics are preserved for their antimicrobial activity. Clear? Na abar bolbo ekbar. So these beta-lactamase inhibitors, they doesn't have any antimicrobial property, but they have a beta-lactam ring. Clear? So now the organism which is producing beta-lactamase, they are going to break some beta-lactam ring. There are beta-lactam ring of antibiotics also, and for this beta-lactamase inhibitor, their affinity is more than this beta-lactam ring of antibiotic. So they engage, and they are also called suicide enzymes. So they give this beta-lactam ring, and the beta-lactam ring of beta-lactamase inhibitors are destroyed. So enzyme is engaged. So which are preserved, then beta-lactam ring of antimicrobial are preserved for their antimicrobial activity. So there are Clavulanic acid, which is a good oral absorption, Sulbactam and Tazobactam. They give along with, they cannot give along with beta-lactam antibiotics. Depending upon the pharmacokinetic, Clavulanic acid can be given with Amoxicillin. Ki naam? Amoxiclav. Why they preferred Clavulanic acid over Sulbactam, Tazobactam? Because their pharmacokinetic are similar. For Amoxicillin, Clavulanic acid are similar, and it can be given orally. Name is Amoxiclav. Clavulanic acid along with Ticarcillin given injectably. Why? Their pharmacokinetic basis are similar. Similarly, Sulbactam given with Ampicillin, both injectable and oral, whereas Tazobactam given with Piperacillin injectable. Cause is same, the pharmacokinetic is same for these two drugs. Clavulanic acid with Amoxicillin, Sulbactam with Ampicillin, and Tazobactam with Piperacillin. Piperacillin is which group of drug? Extended spectrum anti-pseudomonal penicillin. Similarly, Ticarcillin is extended spectrum anti-pseudomonal penicillin. Next is cephalosporin. Cephalosporin also has a beta-lactam ring and they have a dihydrothiazine ring. Dihydrothiazine. Why it is important? Beta-lactam ring is important. Beta-lactam ring is important for its pharmacodynamic activity, whereas dihydrothiazine ring is important for its pharmacokinetic activity. So, how mechanism of action? Mechanism of action is similar to the penicillin. কি করে penicillin কিভাবে করে? Inhibit করে. Mechanism of action is similar to the penicillin. ওইগুলো সব লিখতে হবে, ঠিক আছে? Then they have also cephalosporinase equivalent to the beta-lactamase or penicillinase. That means they break down the beta-lactam ring. Which one? CN. Remember that? কোনটা অ্যাসিড ভাঙে কোনটা ইয়ে ভাঙে? অ্যামাইড ভাঙে? Like penicillin, cephalosporin also binds with the beta-lactamase inhibitor. Beta-lactamase inhibitor এর নাম কি? Clavulanic acid, Sulbactam, Tazobactam. Mechanism why it's combined? না, ফার্স্ট কেন বলতে হবে যে they have a beta-lactam ring, they doesn't have a antimicrobial activity, they have more affinity towards the beta-lactamase enzyme, so their beta-lactam ring is destroyed by preserving the beta-lactam ring of antimicrobial, and they combine. Another important thing is that the pharmacokinetically similar type of drugs are combined. So remember, there are 5 generations and you have to remember few of this. In first generation, you have to remember the name of cefazolin. Why? Cefazolin is used for surgical prophylaxis. Cefazolin is given parenterally for surgical prophylaxis. Second generation, they cover gram-positive, gram-negative anaerobes. Anaerobes not against the pseudomonas. Gram-positive, gram-negative anaerobes. Now, they are also oral and parenteral. Cefuroxim, cefomindol, these are all parenteral. And another thing is that product, cefuroxim acetyl. Cefuroxim acetyl, you have to remember, acetyl is a product and it is for the second generation. Now, third generation, most commonly used, third generation, these are active against the gram-negative even in the pseudomonas, resistant to beta-lactamase, less active against the gram-positive. And most commonly used in our setting is ceftriaxone. Ceftriaxone is injectable or parenteral third generation. Another thing is that cefodoxim proxetyl, that one is cefuroxim acetyl, and this is cefodoxim proxetyl. That is also a oral drug and prodrug, but third generation. You have to remember acetyl starting with A comes before P, that is proxetyl, is in third generation. Acetyl come in the first generation. First generation, second generation, third generation. Ceftriaxone, third generation, commonly used injectable drug. Other than ceftriaxone, cefotaxime, ceftazidime is also important. cephalosporin. Fourth generation cephipime, cephipirome, they are resistant to the beta-lactamase and given parenterally. Now there may be some fifth generation also developed ceftobiprole. These are fifth generation, activity against the gram positive better than the fourth generation and given parenterally. So you have to remember at least there are 5 generations nowadays: first, second, third, fourth, fifth. And characteristics, first one is gram positive, second one gram positive plus gram negative, third generation shifting towards the gram negative, avoiding gram positive, included pseudomonas by some. Then fourth generation, they are more active against the beta-lactamase and then fifth generation again come covering the gram positive one. Clear? MCQ যদি কোথাও থেকে আসে কিছু করার নেই। সেফিপাইম, সেফট্রিয়াক্সোন, গোদা জিনিসগুলো মনে রাখতে হবে। সেফিপাইম is a fourth generation, ceftriaxone, cephalosporin, ceftazidime, these are third generation parenteral. Cefazolin is the first generation parenteral given for surgical prophylaxis. Now Axityl and Proxytyl both are orally given. A comes before P. A is second generation, P is third generation, given orally prodrug. You have to remember cefazolin given IV, Axityl, Proxytyl already discussed, these are prodrugs. Cephalosporin, ceftriaxone secreted by the bile, secreted ceftriaxone, you have to remember ceftriaxone excreted to the bile along with cephalosporin. CSF penetration, again in CSF penetration ceftriaxone is very good, along with ceftriaxone is very good. Ceftriaxone is which group of? Third generation. Third generation ceftriaxone, bile secretion, good CSF penetration along with cefuroxime, cefotaxime, ceftriaxone. কিছু করার নেই, কিছু মনে রাখতে হবে, এগুলো এমসিকিউ এলে নালে বাদ চলে যাবে। প্রেগন্যান্সিতে সেফ, প্রেগন্যান্সি সেফ এগেন সেফট্রিয়াক্সোন। তাহলে সেফট্রিয়াক্সোনে কি হলো? বাইল দিয়ে সিক্রেট, প্রেগন্যান্সিতে সেফ, সিএসএফ পেনিট্রেশন ভালো, অল থ্রি সেফট্রিয়াক্সোন। Cefazolin, drug of choice of surgical prophylaxis. Surgical prophylaxis is drug of choice. Ceftazidime, cephalosporin, active against pseudomonas. It is anti-pseudomonas cephalosporins. Anti-pseudomonal cephalosporin is, you have to remember, ceftazidime and cephalosporin. Ceftazidime, cephalosporin, not ceftriaxone. সবকটাতে ceftriaxone বসিয়ে দেবে না। ceftriaxone কি হলো তাহলে? CSF penetration মানে meningitis, বাইল সিক্রেশন মানে রেনাল ফেলিউরে তুমি ইউজ করতে পারবে, ঠিক আছে? আর প্রেগন্যান্সিতে সেফ। ড্রাগ অফ চয়েস অফ সার্জিক্যাল প্রোফাইল্যাক্সিস ইজ সেফাজোলিন, which is a first generation cephalosporin. First generation cephalosporin. Ceftriaxone is first choice of gonorrhea, salmonella, E. coli, proteas and hemophilias, whereas ceftriaxone is based against bacteroids. Bacteroids is anaerobic bacteria. Here also not ceftriaxone, ceftriaxone. Ceftriaxone bacteroids coverage best among these all cephalosporin. No cephalosporin active against MRSA. MRSA full form methicillin resistance Staphylococcus aureus or Enterococcus fecalis. Nephrotoxicity can be produced by cefazolin and cephalosporin. These are produced, they can produce nephrotoxicity. cross-allergic between cephalosporin and penicillin is there, it is close to 20%. So if a patient is allergic, not resistant, allergic to penicillin, we should avoid cephalosporin also. Clear? Now, bleeding and disulfiram-like reaction. Bleeding, disulfiram-like reaction means? Yes. কার দিয়ে হয় এটা? কি কেন হয়? হ্যাঁ? অ্যালকোহল কনজাম্পশন হলে কি হবে তাহলে? হ্যাঁ, তাতে কি হবে? accumulation of acetaldehyde, they can produce this. And these drug can produce disulfiram-like reaction as well as increased chances of bleeding. You have to remember one cephalosporin that is not started with C. That is Amoxicillin, cefotitan, cefomendol, cefoperazone. These drugs causes disulfiram-like reaction. Other drugs that can name any other drugs that can cause disulfiram-like reaction? Metronidazole. Clear? Other than metronidazole, there are cephalosporins that can also produce disulfiram-like reaction. Next is Monobactam. Monobactam ki naam? Aztreonam. They have only one ring, only beta-lactam ring. Like other, like penicillin or cephalosporin, they have two rings. One beta-lactam and one that controls their pharmacokinetic activity. But here only one ring. They usually not destroyed by the beta-lactamase, doesn't show the allergic reaction like penicillin or cross-allergic reaction with penicillin. So we cannot give cephalosporin if the patient having penicillin allergy, but we can give Aztreonam or Monobactam because there is cross-allergic reaction is less, excreted unchanged through the urine. Monobactam. Aztreonam commonly used, primarily cover gram negative. তার মানে এতক্ষণ পর্যন্ত আমরা কি বলছিলাম? পেনিসিলিন প্রাইমারিলি গ্রাম পজিটিভ, এক্সটেন্ডেড স্পেকট্রাম গ্রাম পজিটিভ প্লাস গ্রাম নেগেটিভ। সেফালোস্পোরিন ফার্স্ট জেনারেশন গ্রাম পজিটিভ, আস্তে আস্তে গ্রাম নেগেটিভে শিফট করলো, দিয়ে লাস্টে আবার ফিফথ জেনারেশনে গ্রাম পজিটিভে, ফোর্থের থেকে বেটার হলো। সিমিলারলি Aztreonam cover gram negative. Now there is a inhalational product of Aztreonam that used in cystic fibrosis. Cystic fibrosis কি হয় জানো? There is a cilia in this lung and tracheobronchial tree and they are less developed. So thick sputum is accumulated in the tracheobronchial tree and that can lead to bacterial infection. So in this situation, because it only given inhalationally, so systemic absorption is less, local concentration will be high. Aztreonam in inhalational route. Name some other drugs that can be given in inhalational route. Huh? There are two things. One is systemic route, one is local. Local route are used in কোথায়? In asthma or COPD. কি কি ড্রাগ ইউজ হয়? লাবা, সাবা মানে বিটা অ্যাগনিস্ট না অ্যান্টাগনিস্ট? বিটা অ্যাগনিস্ট। Then anticholinergic, inhalational anticholinergics like ipratropium, tiotropium bromide and inhalational corticosteroid. These are given inhalationally but acts locally. There are other group of drug that gives a inhalational route but acts act systemically. Name some of these drugs. Nitrous oxide, halothane, fluorens. These drugs given inhalationally, they go into the systemic circulation, and from the systemic circulation they go into the site of action. It is in CNS or brain. So these drugs given inhalationally but acts systemically, whereas drugs used in bronchial asthma, they give this drug inhalationally but acts locally. Why this difference? Because to reach its site of action, that is tracheobronchiality, it doesn't require to go into the systemic circulation. But for the inhalational anesthetics, it requires. Clear? Similarly, this here the example of Aztreonam given inhalationally and acts locally. There may be some systemic absorption, but our target is primarily local action of this antibiotic. Clear? Aztreonam, Carbapenems, beta-lactam ring with 5-member ring system. Post-antibiotic effect. Post-antibiotic effect means when the concentration is less than adequate, even then there are some post-antibiotic effect is there against gram-negative bacteria. Gram-negative. Carbapenem is a beta-lactam antibiotic. It is different from penicillins. Eliminated unchanged through the urine, they bind with the protein by penicillin binding protein and inhibit cell wall. It is a beta-lactam antibiotic. It is a reserve antibiotic. It penetrates CSF. তাহলে penetrate CSF means কোন ইনফেকশনে দেওয়া যাবে এটা? Meningitis, encephalitis. If there is bacterial meningitis, bacterial encephalitis, we prefer these drugs. We reserve these drugs. Only beta-lactam reliable against extended spectrum beta-lactamase producing bacteria. Extended spectrum. Extended spectrum beta-lactamase against a carbapenem is the only reliable antimicrobial. Carbapenems. So these are the carbapenems: Imipenem, Meropenem, Aztreonam, Doripenem, and Pharmacology. Among these, Imipenem mostly given with the cilastatin. Clear? Why? Because this Imipenem is destroyed by one enzyme called dipeptidase 1, and this dipeptidase 1 is present in the renal tubule, and cilastatin irreversibly inhibit this dipeptidase. So Imipenem we nowadays given always with cilastatin. You have to remember this, why we give Imipenem along with cilastatin, because cilastatin inhibits an enzyme called dipeptidase 1 present in the brush border of the renal tubule, which destroyed the Imipenem. Don't confuse penicillin with clavulanic acid, amoxicillin with clavulanic acid, ampicillin with sulbactam. They are suicidal drugs having beta-lactam ring. Clear? And this is different. This enzyme is not producing enzyme resistance. They just destroyed the Imipenem. Clear? It is not development of resistance. Efficacy will be less, not developing resistance. Clear? And this cilastatin is not required for Meropenem or other carbapenems like Pharmacology, Doripenem, Aztreonam. Among all these, only Pharmacology can be given orally. Another MCQ, carbapenems given orally is Pharmacology. All other drugs given injectable, and only imipenem can be destroyed by dipeptidase 1. Other antibiotic that inhibit cell wall. তাহলে এতক্ষণ পর্যন্ত আমরা কি পড়ছিলাম? beta-lactam inhibitor antibiotics, beta-lactam antibiotics কি পড়লাম? penicillin, cephalosporin, carbapenem, Aztreonam, ঠিক আছে, monobactam বা Aztreonam, ঠিক আছে। তাহলে how they act? They have a beta-lactam ring. That beta-lactam ring is important for their pharmacodynamic action. Clear? And by destroying the beta-lactam ring, there is production of resistance against it. And how they act? They act by inhibiting the cell wall. এই পর্যন্ত ঠিক আছে তো? তাহলে cell wall inhibitors are beta-lactam antibiotics plus something. Not only beta-lactam. Beta-lactams, all beta-lactams like penicillin, cephalosporin, carbapenems, monobactam acts by their beta-lactam ring by inhibiting cell wall, not cell membrane, cell wall. There are other drugs like vancomycin, phosphomycin, bacitracin, cycloserine, teicoplanin. These are along with beta-lactam. Along with beta-lactam means penicillin, cephalosporin, carbapenem, monobactam. Plus these drugs like vancomycin, phosphomycin, bacitracin, teicoplanin, daptomycin, all are in cell wall inhibitor. You have to remember, not only penicillin. Penicillin is a beta-lactam antibiotic acting by inhibiting cell wall. Cephalosporin is the same. Monobactam is the same. Beta-lactam, but there is non-beta-lactam antibiotic. They can also have their action by inhibiting cell wall. Namely, vancomycin, where it is used primarily MRSA. Vancomycin is used in MRSA. Similarly, teicoplanin, cycloserine, bacitracin, and phosphomycin, their action is against cell wall, but they doesn't have a beta-lactam ring. Clear এই পর্যন্ত? So all cell wall inhibitors are not beta-lactam antibiotics, but all beta-lactam antibiotics are cell wall inhibitors. Clear এই পর্যন্ত? ভ্যানকোমাইসিনের দুই একটা জিনিস মনে রাখতে হবে, they inhibit cell wall by D-alanyl-D-alanine portion of terminal peptidoglycan, by inhibiting that. And along with cell wall, they can also damage cell membrane and increase permeability. Where it is used? Vancomycin, MRSA. Another thing is that it can used primarily injectable drug, but there is a situation called pseudomembranous colitis. কিভাবে হয়? When there is a broad spectrum antibiotic. Name some broad spectrum antibiotic. Tetracycline, chloramphenicol for long duration. There is a possibility of production of this situation, pseudomembranous colitis. Most of these vancomycin use are injectable. In MRSA we give injectable, but in pseudomembranous colitis, as it required to concentrate locally in gut, we give oral vancomycin. Clear? So which drug produces pseudomembranous colitis? Broad spectrum antibiotic. And which drugs are used for pseudomembranous colitis? Oral vancomycin and oral metronidazole. Oral vancomycin and oral metronidazole is used for pseudomembranous colitis. Drug of choice of MRSA. Another MCQ is red man syndrome. Red man syndrome caused by injectable vancomycin by releasing histamine. Clear? Pictures are like this. injectable vancomycin by releasing histamine. The gray baby syndrome, which drug causes? Huh? Very good. What are the other important side effects of chloramphenicol? Idiosyncratic type of bone marrow suppression. What is idiosyncrasy? Huh? Dose independent. Very good. So it is not that up to 10 milligram there is no bone marrow depression, above that there is bone marrow depression. It is not like that. Even with 1 milligram, patient A can produce bone marrow depression, and with 10 milligrams, even in 100 milligrams, patient B doesn't develop this bone marrow depression. It is by idiosyncratic type of bone marrow depression by chloramphenicol. Which drug causes discoloration of teeth? Very good. Which drug causes tendonitis? এগুলো কিন্তু সবকটা এমসিকিউ আসবে। ডিএনএ জাইরেজ ইনহিবিটরের নাম কি? হ্যাঁ, topoisomerase 2. Fluoroquinolones causes tendonitis. Clear? Redman syndrome হয়ে গেল। Teicoplanin is also given when MRSA patients not tolerating vancomycin. Daptomycin is alternative to vancomycin except in case of pneumonia. And any infection other than pneumonia, when vancomycin is not controlled, daptomycin can be given because they causes the damage in the pulmonary surfactant. ঠিক আছে, beta-lactam প্রথমে যে মেকানিজম অফ অ্যাকশন, beta-lactam ড্রাগ কোনগুলো? They act by inhibiting cell wall. There are, you have to remember, there are drugs like vancomycin, teicoplanin. They are not beta-lactam antibiotic, but acts through by inhibiting the cell wall. Clear এই পর্যন্ত? মানে প্রত্যেকটা পার্টে কোশ্চেন আছে। এমসিকিউ, explain why, short note as a part of long question. ঠিক আছে? And in oral, ওই কার্বক্সিপেনিসিলিন আর কার্বাপেনেম যেন গুলিয়ে না যায়, কারণ পরীক্ষায় ফার্স্ট কোশ্চেনটাই ওটা ওরালে আসতে পারে। এই ড্রাগের নাম ওই ঘাড়ে যেন না চায়।